Welcome to the Listen Up podcast, where we explore hearing loss, communication, connections, and health.
Hey everybody, Dr. Mark Syms here. I'm the host of the Listen Up podcast, where I feature top leaders in hearing healthcare and hearing loss. This episode is brought to you by Listen Up Hearing Center. I help patients to effectively treat their hearing loss so they can remain connected to their friends and family and remain independent. The reason I'm so passionate about hearing loss is because I lost my brother Robbie twice. First, the hearing loss from radiation to his brain tumor, and then when he passed away. I am an E of ENT. I only care for ears. I've performed over 10,000 ear surgeries in my career and taken care of many more with hearing loss. I'm the founder of Listen Up Hearing Center. I'm the author of a book of the same name, Listen Up, A Physician's Guide to Effectively Treating Your Hearing Loss. If you want to learn more about that, go to www.listenuphearing.com. That's www.listenuphearing.com. I have a great guest today. She's a patient of mine, which I think is an exciting area to explore. It's Amanda Mason. She is a licensed clinical social worker for the past 2 decades. During her 10 years as a social worker, she's worked in a lot of different areas in healthcare setting, and she's been both a manager and in clinical roles. The reason we have her today, she's a lifelong hearing impairment, and she's married and the mother of 2 awesome children who I've met. And they're very enjoyable, and her husband's a great joy as well. Amanda, thanks for coming on the show. I appreciate you coming here.
Oh, it's my pleasure. Thank you for having me.
Sure. One of the things that I think about is, there are all of these other people out there who have hearing loss, and, they feel like they're alone and they're the only one going through it. And it is lonely, but they're not alone. And so, I think if others share their hearing journey and what it's been like for them, that can maybe help them identify with some of what you've gone through. So tell me a little bit about, when you were diagnosed, if you would, and share that and what you recollect at the earlier parts of your hearing loss.
So my earliest memory, gosh, I can't even remember my whole life.
So you can't remember not having a hearing loss.
I can't remember. Yeah, it's always been in my life. I was born with it, and I was very, very fortunate. My mom really made it a priority to make sure that I had the equipment and resources that I needed to be successful. So my entire life, I've had some.
So obviously you recollect your whole childhood in school. So did you wear hearing aids in school? And
I did. Yep.
Okay.
Both years. Yep.
And so how did your hearing loss affect you in school, if it did at all? Now, what I would say is you speak very well. So I don't think it has social and emotional effects, but from a speaking point of view, you speak very clearly.
Yeah. And I was, I went to a smaller school. So I really was encouraged to speak up and ask questions when I needed clarification or I didn't understand something. I was really encouraged to do that. And I really made a really big difference. I appreciated that very much. And it's funny, I actually, I studied Spanish, and I remember at one point my Spanish teacher was, wow, it's amazing how you understand and comprehend this, because even though I have a hard of hearing, I was able to succeed in a lot of different areas. So languages included.
Well, that was great. So how do you think people taught you that kind of self-advocacy? It sounds like, the willingness to kind of raise your hand when you didn't know and things like that. Do you recollect how that was kind of ingrained or taught to you?
My mom really, and I was a shy kid, so it didn't necessarily come naturally to me. So she just said, people can't read your mind. People don't know it. You can't really see people's ears, hair covers it and all that stuff. So, and it was actually a journey for me to actually feel comfortable raising my hand to say that can you please repeat that? I didn't understand what you said, and because I didn't really want to bring attention to it, quite honestly. Right. So it was something that took a lot of time and practice and, encouragement. So my mom really was my advocate in encouraging me to do that.
That's great. And so what age do you think you came into that? Just about
I think 4th grade. What are you, 9? I think 9. So that was really where I remember I had a teacher that was like, you could be asking a question that other people might want to know. And it's important for you to put your voice out there. And if you didn't hear what I said, I need to know. So it was a combination of a teacher and my mom, actually, now that I think of it.
You remember that teacher?
I do. Mm-hmm.
Who is it?
Her name is Ms. Redline.
Think about that, right?
Yeah.
How many, we all have, at least a half a dozen teachers every year. And so over 12 years, that's, 72 teachers, but you
Mhm.
remember. Right.
I
Yeah.
remember her. Yeah, she was saying you need to let me know. And so it's a combination, the teachers and family for sure. And
Well,
I
shout
also,
out to her, right?
I'm sorry.
Shout out to her.
Absolutely, absolutely. Yeah.
So that's good. Did you wear your hair long?
When I was a kid, yeah, it was pretty long. I mean, variable length, but
So did people know you had a hearing impairment or because they didn't see your hearing aids, right?
um, I mean, people they did know. I mean, kids are kids, so and I was pretty quiet kid, so I don't know. But yeah, I'm sure they knew. They didn't really ask me about it or talk to me about it, but
Sure.
I'm
Did you ever rebel against your hearing aids?
no,
Okay. 'Cause, I
I
mean,
did not.
some kids do that in their teen years, right? And,
Yeah, no,
and
I
so
didn't.
how long were you a hearing aid wearer?
How long? Well, I'm still a hearing aid wearer. I wear one hearing aid now.
Okay, fair enough.
Yeah.
So, so how many years it's been? So, well, can you describe maybe your experience? I mean, so as you've worn hearing aids longer, obviously the hearing aids have changed too.
Yes.
And
Yes.
so, what has been your experience like? I mean, I don't know if you can recollect, or how would you describe to people like how much the technology or hearing aids have come along? Like, so, is there a way you could describe it to people what it was like before and what it's like now?
Yes, absolutely. And you're just talking about hearing aids, right?
Yes.
Okay. So, absolutely. I remember at not every, I think I remember when I was 16 or 18, around that time, I got a new set of hearing aids. And I remember one day I was sitting there and we were in my like living room and we had like a screen door open and I was hearing this noise and I was like, Mom, what is that? I'm like, what is that noise? You know? And I realized it was a bird chirping. And I was like, oh, I've not heard it that way before. And so yeah, it's like with every set of hearing aids, it's funny. When I first get them, sometimes I'm not always like it takes an adjustment. You have to like have this period of adjustment. When I first get them, it's not like I hear it super clear and I love it the first day. It takes probably a good month for me to really, really get and enjoy and really get acclimated to it. And that month can be really fun in some ways. Like I said, with the bird chirping, and there was another time I remember getting a set of hearing aids and I was driving my car and I was listening to a song. I remember it was Living on a Prayer and, I there's like this thumping, like, and I'm like, "What is wrong with my car? Why is there a thumping?" And I kept turning on and off the volume of, and I'm trying to figure out what's going on. And I realized it was the drum in the song. And it was a song I listened to so many times. And suddenly here I am, and I have this new set of hearing aids and I can hear it. So life just gets a little more like richer with every set that I have. And I mean, those are the two main examples that I have where it was like, oh my gosh, that's wild. It's very cool.
Well, how about other things? What other things have improved for you, like connectivity?
Oh yes, absolutely. And that's really been in the last decade, I would say, the Bluetooth has been amazing. I hear things and I've actually I love audiobooks. I never used to listen to audiobooks and because you can't see people's
Because it was hard, right?
yeah,
So
you can't
the
see people's
audiobook was hard.
yeah. So I never liked audiobooks, but now like with Bluetooth capabilities, I love audiobooks. And I can listen to them in like different accents, the narrators in different accents. It's wonderful. It's brought so much pleasure to my life in that regard.
What's the favorite audiobook you've listened to?
Oh my gosh. My favorite, I've listened to so many. I just listened to The Great Alone by Kristen Hanna. That was really good.
Oh, great, great. No, I mean, it's just kind of, it's amazing what access to sound and better access to sound, what things you can do that you weren't able to do
Yeah,
before.
absolutely.
So, I know your story, but tell us a little bit about your hearing loss. In other words, you had a hearing loss. Has it been the same? Did it get worse? What's kind of happened over your life in terms of your hearing loss?
So as I was born with my hearing loss, and when like I said earlier, it was helped with hearing aids, and I had hearing aids in both ears. It had a traditional childhood. Um, when I was 14, I came home from softball practice one day, and I hearing was just kind of like fuzzy. It wasn't as clear. And I remember, I was like, gosh, I must be really tired. And I woke up the next day and my hearing aids were not helping. Like I could not hear. And alarming. I was like 14 or 15. And so my mom went to the doctors, got it checked out, couldn't figure out what's going on, figured out that I had an episode of what I now know as sudden sensorineural hearing loss in both of my ears, and which it had to be treated, and it was treated with steroids. Eventually, my hearing rallied back, and I, flash forward 20 years, um, I graduated high school, college, got my master's in social work, found my wonderful husband, got married, and I was 34 and I woke up one day and it was deja vu, except it was just one ear. I could not hear out of it. My hearing aid wasn't helping. And I remember I was like, well, maybe it's allergies. I don't know. Well, this could be anything, right? And so I went to my ENT and looked at my ear and he's like, oh, no, it looks okay. Let's test your hearing, make sure everything's okay. And I got it tested and they confirmed that I lost my hearing. I didn't have it, that's why my hearing aid wasn't helping. And I remember just like sobbing in that chair and being like, what is this? This is happening again, And that ENT, I'll never forget. He was so kind. And he said to me, things change in 20 years and, treatments change. And he said, I'm going to refer you to a wonderful doctor, Dr. Mark Syms, and, and he'll help you out. And I think I saw your office like not even a week later. It was pretty quick. And that's when I first met you.
Right.
Yeah. And
That was before children.
It was before children.
Or were you either that or pregnant? I can't remember.
No,
before children.
Pregnant,
You had not had it. It was before children.
Yeah. Yeah. This is my pre-children life. And so I came to you and, got the treatment and with the steroids, which is different way that it was administered. But, my hearing rallied, it came back. And I remember you said to me, look, Amanda, if this happens again, we need to treat this like an emergency. Like there's a window of time that we need to get this treated in. And anyways, I remember thinking, the reason I say that is because I remember thinking, okay, well, I'll see you in 20 years.
Yeah, right.
I'll see you. Yeah, I'll see you when
I'll see you for the next episode. That'll be in my 50s.
Right. I'll be 50, right?
Hmm.
Yeah. But as you mentioned, I had, I was back in your office 15 months later and I had a 3-week-old baby and I got, in treatment again. And it really began this cycle of, and predominantly in my right ear, of these episodes of hearing loss, getting the steroids, my hearing rallying. And then at some point, it was over the course of about 5 years and many episodes of this happening where I really realized that I needed to look at other options and other solutions. And eventually in March of 2021, I got a cochlear implant and in that ear. And it has been such a gift. What it has brought to my life has just been wonderful. And I'm so grateful for it. So where I'm at today, today, as a child with 2 hearing aids, and today I'm bimodal, which means I have a hearing aid in one ear and a cochlear implant in the other.
Yeah, you got the lingo down there, right?
What did you say?
You have the lingo down.
I do.
Because you've been around it a lot. So I'm not trying to mull up too much, but, the feelings that you had, as your hearing was going down, I'm not trying to get to relive it, but, if you're willing to share with the audience, because I think there are a lot of people who have these fears and, understanding that there's other people who have this and it's normal would be really helpful.
Absolutely. It was a roller coaster. That's the only way. This is the best way I can describe it. Because it was like, it got to a point where I was like, I'd wake up and if something was even a little bit off, I would panic. I'd be like, oh my gosh, like this is happening again. And just this, and I remember like, I would run to my husband. I'd like, say something in my ear, because I didn't know if my hearing was stable. It was up and down all the time. And it was it was a lot. It was a lot. And, I was raising young children and dealing with that at the same time. It, I'm very, 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 very fortunate for the support that I have. My husband is wonderful. My mother is wonderful. My in-laws. I mean, just, I'm so grateful for that because they really helped me a lot to help get through that period. But it was hard. It was really
Fear
hard.
and sadness, wouldn't you say? A lot of fear
Absolutely.
and sadness.
Yes. Fear, sadness, anxiety. Yeah.
Yeah. Yeah. And so, I mean, you're great on this side, but I mean, the reason I ask you that is there are people out there who are experiencing the exact same thing. It's not good, but it's not. They're not the only ones that feel this, right? I mean, that would be a fair thing, right? And so,
Yeah.
I guess the answer is get support, right? Have people around you
Yes.
who can
Absolutely.
support you.
Yeah. And when I look and looking back to, it was first time I had one of these episodes, I was 14 and I was, a child. I was a teenager, right? Dealing with my own, like, learning your own coping skills and you're learning how to navigate the world. So when I look back on that time period, the difference between that and my adulthood was having the coping skills and telling people, "Hey, I need you to speak up," or "Hey, this is really hard." And still, you have to. I had to practice it. It didn't always come naturally. I don't love bringing attention to it, but sometimes I have to, like, especially if I'm raising kids and I'm, you know, but it's definitely been a journey.
Are there ever times where people come to you and go, "I didn't realize that you were hearing impaired"?
Oh yeah.
Well, that's a compliment, right? In other words, they might have known you for some period of time, and then they're like, "Oh, you know what? I didn't actually know you had a hearing loss."
Yeah. Yeah.
And so, well, that's wonderful. And so, if you were talking to people who are watching this who have these types of feelings, what would your advice be to them?
So the feelings, meaning like the fear.
Fear, the anxiety, the sadness. I mean, I tell people one of the things I tell people that is that you have a right to be sad, right?
Oh,
To me, if you look at the stages of mourning, so now I'm getting into your wheelhouse, right? With the Kubler-Ross stages of mourning of death, right? And I would say that many people go through those stages. So for the listeners, if you want to know what I'm talking about, you can Google Kubler-Ross. She was a Catholic nun who watched people die, and she categorized the different stages that people go through. So it doesn't just apply to that; it applies to almost any loss. And so,
absolutely. Yes. And I remember you told me at one point, when I was, when I had finally decided to get a cochlear implant, I was like, I can't believe this took me as long as it did to get here. And I remember you said, well, you had to grieve. You had to grieve, and you were right. I did, and I was thinking about this even, as I was preparing to chat with you today, I was thinking, you know, yes, I was born with a hearing loss, but I didn't, in terms of a discernible loss, I didn't experience that until I was 14. And then again, when I was 34,
so
because
the
I had hearing and then suddenly I lost it. And
right.
then it comes back and it's like, so you have these episodes of loss. And yes, so people that are listening and experiencing this, like, gosh, it is normal. It is so normal. And to feel sad and to feel overwhelmed and feel like it's not in your control. It's so hard.
Because it's not.
Yeah.
Right. I mean, the loss of the hearing is not, the rehabilitation of the hearing loss is, right? So
Absolutely.
and so that's part of it too, right? And I know when you and I first met, you first actually weren't a candidate for cochlear implant, so
Right.
but you did progress, and if I recollect, there was some resistance on your part in
Mhm.
terms of that. And so,
Mhm.
can you talk a little bit about? I mean, it's interesting. I talked to a patient today, and she looked at me and she said, "I don't want a cochlear implant." I was like, "Well, nobody comes in here saying I want a cochlear implant."
Oh,
It's the conclusion of the medical intervention that makes sense for their impairment. But I
yeah.
mean, I know you went through that and had to negotiate that for yourself. Can you share a little bit about that?
Yes, absolutely. So for me, you mentioned the stages of grief. So denial is one of them, right? And so
Right.
for me, I was definitely in that phase for some time. And I was like, no, I'm gonna figure out why this is. I'm gonna figure out why this keeps happening. And I remember like trying to like find out solutions, try to understand and all that stuff. And so, I remember feeling at one point like when I decided to make when I made the decision, like I said, I was like, what took me so long? And when I look back on it, I'm like, I had to go through that. I had to like figure out like, okay, why is this happening? And do all this research and do all that stuff because it helped me kind of embrace that decision and to embrace that choice. But initially I wasn't like, oh, I'm going to do it. It took me time to get there.
Yeah, and I think it also gave you control of something you didn't have control of, right? So if you
100%.
right, and so obviously you didn't take the decision lightly. So what were the things that kind of tipped you over to decide? I mean, for the listeners, Amanda met the clinical criteria for cochlear implantation, meaning her hearing was poor enough that she qualified for the criteria that are set forth for somebody to qualify. So, that's the first thing that has to happen. Not, I don't qualify, but I want one, so I'm going to get one. That's not how it works, right? And so, but if I recollect, you were actually a candidate longer, then, it wasn't like you became a candidate and you rolled right into it. So there were some processes in terms of that decision.
Yeah. So looking back, it was actually some of the staff in your office, and that I remember two key conversations. One was with someone that was testing my hearing, and I remember he looked at my chart and he's like, "Gosh, you've had a lot of hearing tests." And I was like, "Yeah, I have." And I mean, you only know your own experience, right? You don't know
Right.
the experience of others. So obviously, I'm like, well, if he's making that comment, that must say something,
Well,
you know?
most of our patients do not have double-digit number of hearing tests, right? And I
Yeah,
mean, in the short period of time in which, because you would get an intervention, we test you, 3 weeks later, and then we test you 4 to 6 weeks later to make sure it was still stable,
right.
and then you'd have another drop, and then we'd verify it dropped, and then we'd do that all over again. So you could have
Right.
double-digit hearing tests in a year, which
Yeah.
nobody who's hearing impaired likes tests because they feel like they fail them.
Yeah. Yeah. And I remember, yeah, but he made that comment. He was like, "Oh my gosh," and he wasn't like in a judgmental way. He was
It's
just like,
just a statement of
it was
of
just a
like
statement.
wonder, right?
And I remember he's like, "Have you ever considered a cochlear?" And I said, "It's been mentioned." And that was all. It was just something about that interaction, just like the genuine like curiosity. And I
Right.
was okay. And then it was maybe 6 months later, someone else in your office. No, like there are people out there that really kind of like, you know, they fight it and then they decide to get the implant and then they look back and say, why did I wait so long? And I remember being like, okay, now like people are they're like planting the seed, and I'm like, okay. And then ultimately, I ended up talking. My mother has a very dear friend who has cochlear implants in both ears, and I remember speaking with him and just talking about the journey, and it just really just solidified for me. And ultimately, I think my decision came down to my children and my family because I always want I always want to hear my kids say I love
Mhm.
and say mom and say, hear my husband's voice. And like, I don't want to lose that. And that is so enriching. And I remember a conversation I had with my husband, that must have been 2019. I remember saying that this is going to happen. Like, it's going to happen. Like, I'm going to get this implant. Like, I know it's not going to be in my 60s or my
Right.
50s. It's going to be in my 40s. And I got one. So it was just a process. I think a combination of people having conversations and making comments and talking to people during my research and, leaning on my friends. I have wonderful friends all over the country. I mean, just ultimately conversations with people and then helping me to come to that own decision.
So I'll ask the question: do you wonder why you waited so long?
Absolutely. Yeah.
I would say that that's there's I mean, there are some people like, yeah, this is good, and I'm glad I did it. There are an element of people like, why did it take me this long to? But I mean, I think there are a lot of things in life that are that way, right?
Yeah.
Once you
No,
get there, you right. So,
yeah.
and
Yeah.
so, if
The
there
process.
was somebody out there kind of waiting so long, what would your advice be to them?
Mm.
Maybe
Understand.
they have to go through the process, right?
Go through the process, do your research, ultimately, like, everything we make decisions. I'm like a pro con person, right? You make a pro con list, right? Like, so do your research, make your pro con list. It is, look, getting an elective procedure is there's risk. I understand that there's risk, but looking at the benefit, like my life is so enriched, like by having this implant. And the thing is, it's brought me stability. It's brought stability in my hearing,
Right. It's
and
not fluctuating anymore, right?
it hasn't. I haven't. This is my first time seeing you in like 2 years. I
Right.
could see you multiple times a year. you know, so it's brought me stability. It's brought me, a sense and an understanding of how essential hearing is to health and well-being. Like it is essential. And I've seen that in the changes I've been through in the past 2 years. So for someone who's on the fence, there could be things that are potentials you don't know about, like that you could gain from this that may not even be on the pros list because
So what are the birds of the cochlear implant? Like you talked about when you got your upgrade of your hearing aid, right? And so, I mean, I have patients who tell me, I had one guy tell me, I forgot that going to, urinating in the toilet made noise. I have other people that say, oh, I'm looking around for this humming sound and I realized it was my refrigerator.
yeah,
So what
yeah,
type of things did you, or have you noticed that's more rich?
absolutely,
Besides
absolutely.
audiobooks, that's clearly one thing you love.
Yeah, absolutely audiobooks. So the other one that I remember must have been 3 or 4 months after I got this, and this was interesting for me, is that the cochlear implant has brought sounds that I've actually never heard before.
Right.
So for me, I remember I came home. So I dropped my kids off to school. Before I had left, I started a load of laundry. And I took my kids to school and I come back and I hear water rushing. And I'm like, oh my gosh, there's a leak. I'm like, what is going on? I'm like running, I'm looking at all the faucets. I'm like, what is this noise? And I realized, oh my gosh, it's the washer. Like that's like, wow, boy, is that noisy. And but not in a bad way. I was like,
Filling the tub of the washer, right? The water filling the
filling
tub.
the water. And another thing, and this honestly, I kid you not, this happened yesterday. So my kids, we were getting ready, they were getting in the car to go to school. And I ran back in the house to get something and I hear water running. And like it turned out one of them left the sink on, but it started to like flood. And because the stopper was up. So
Right.
I was like, I remember I was telling my husband this when he came home. And I said, thank God for my cochlear implant. We would have had a flood in our house. Like,
Yeah.
I don't think I would have heard the water, you know?
That's awesome. I
Yeah.
don't mean, there are practical safety sides to it. Not that
Yes.
that, but there are actually practical
Oh,
safety sides to it.
so much. So yeah, water and S's are a lot clearer. S, like
Right.
softer.
Your your S's as well, correct?
No, I mean the way that I say S's?
Yes, I think they are.
You tell me.
Yeah, they are. Well, because you can hear yourself now,
Yeah. Yeah.
right? And so you didn't, or if you heard them before, not that your hearing is the same. So that's actually an interesting question. Can you tell or describe a difference between the ear that uses the hearing aid and the ear that has the cochlear implant, or has it all merged for you? Is it all kind of one experience?
It's kind of merged. Yeah. And because I have the one that the
They talk to each other, right? They work with.
yeah, they are like the technology is the same technology and or the software, I guess.
Right.
Uh, and so it's very, very seamless. So it's one unit.
But how about from a hearing experience point? In other words, when you have your hearing aid in or just your cochlear implant on, can you tell, is there a qualitative difference and what
Yes.
is that like?
Yeah. 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 I mean, the sound is different,
Okay.
I don't, it does not, it's the sound with my implant. It's, it's, yeah, gosh, I can't even describe it. It's just, this sounds different,
Right.
but I don't know it. I'm not doing a good job explaining it.
That's okay. No, because I think, well, there are large narratives. People have written whole books on
Okay.
what their experience is with the cochlear implant and what it sounds like, right? I mean, patients will sum it up. Well, it sounds robotic. Well, I'm not sure that that's really the answer, right? And that might be some of the initial stimulation sounds, but it does,
Yes.
as you'll report, it changes, just like with the hearing aid that you described for the first month.
Oh, yeah.
So, how long did it take you to kind of get used to that type of hearing?
So the first month was a lot. I remember, one of the things I did is, and I learned this as a kid, is that my eyes were open, my hearing aid and my implant are on. Like if my eyes are open, I wore them all. I wore it a lot.
Mhm.
And I remember initially though, it was just a lot of beat. Like it was, it would sound like a little bit like R2D2. And I remember feeling a little discouraged, quite honestly, at first. And then, but I kept wearing them. I'm like, all right, my eyes are open. I'm going to have them on. I did the auditory rehab, and I remember eventually it kind of turned into Charlie Brown's teacher, like,
Right.
wah,
Yeah.
wah, wah, wah,
Yeah. Yeah.
right. So it started to sound like that. And then I remember I was doing auditory rehab, meaning like I would listen, I would just have my implant on, not my hearing aid, and I would like listen to something while looking at the words. And so I was doing that, and I remember the song. It was "Don't Stop Believing." I love that song, right? It's classic.
Mhm.
And I remember, and I'm like, I could hear it. I could hear it, like the words so faint. But I could hear the music. And but I could hear it, and I'm like, okay. And then I just kept doing it. And then over time, I would have dinner with my family. I would just have the implant on. And over time I noticed, okay, my husband's voice sounds different from my kid's voice.
Right.
So it was really a journey. So I really think over probably 3 months, I would say 3 to 6 months of this journey but I repeatedly did it. Like I did it all the time. The auditory rehab, having it on, it was just part of my life. And yeah, over time I hear voices. I mean, their voices. It's not beeps. It's not
Right.
a robot. Their voices. So
Okay.
it just sounds different than the voices on my hearing aid side.
That's great. That's awesome. And so, one of the questions I always want to know, like, do you find your energy level or your fatigue less because you can hear better?
Absolutely.
By the way, continue answering. My computer's getting low on power, so I'm answer while I'm getting my power.
Okay. Okay. So yes. So 100%. I used to, when I worked in management roles, I was in meetings a lot. And, I have to concentrate so hard. And even in like clinical care, like I really have to concentrate to hear people's voices. Um, and especially when I was going through this episodes of loss and only had one ear that I was relying on, it was a lot to focus. I would come home, I would be really tired. And now I feel the energy is so much better because I don't have to concentrate as hard.
You
And
don't have
even
to work as hard to communicate, right?
yes, and my family has noticed. My family has 100% noticed. They have made comments like, "Gosh, you're brighter. You have more energy. You seem more confident." And I think it's just because I am, quite honestly.
Well,
So
that's great. I mean, these are kind of the things, I mean, rather than you have a hearing loss, you get an intervention, you hear better. I mean, those are all wonderful things, but these
yeah,
are kind of the more qualitative things that people notice after doing something. Or the flip side of that, which I don't want to really talk that much about, is how tired you are and how not vibrant you are when you have hearing loss and you're struggling to communicate.
yeah, yeah. I look back on that time, and it was definitely draining. But having come on this side of it, it's I'm just so grateful. I don't know. That's all I can really say. How
No,
grateful I am.
I mean that's wonderful, right? I mean, you are able to articulate, in a emotional way how this has helped you, which I think is wonderful. One of the things that's not uncommon is people have a fear of the surgery,
Yeah,
right? And there's multiple reasons. It's lack of control. It is a surgery and things like that.
right.
Without, I mean, would you say it's bad, not bad? What was your experience?
No, it wasn't bad. There were a rough few days, but they were just a few days. So I mean, I remember, yeah, I mean, I don't know how detailed you want me to get, but
I mean, most people, I mean, I'm not trying to say you can tell me, but most people report it's not terribly painful. It's uncomfortable.
no, no, it was uncomfortable, but no, not painful because you just sleep sitting upright. Like there's certain things to help with like drainage and stuff. So
Right.
that part was awkward, and uncomfortable, and but and I remember, I had an upset stomach for a short period of time, but I got through it. And it was short lived. It was not something that went on for weeks or anything. We're talking
Yeah, it's like a day or two, right?
days. Yeah. So you get past it, and then their journey begins when you get activated.
Right. And so, that's one of the things because I have some patients, well, I don't want to go through the surgery. I mean, and that's why I would say nobody wants to go through the surgery. And I take that for granted. But, in terms of, for you, benefits versus surgery, I mean, how would you weigh that? Is it even close to being a calculation? In other words, it's not even a thought, is it?
No, not even a thought. And I know, like, I have now, the other thing that's really neat, I think that I discovered during this journey is I now understand why I have a hearing loss. I didn't know why until I got to doing the preparation. There
Right.
was imaging, and for the
Right.
first time in my life, I know. So I only say that because I know that there is a likelihood that I will one day need a cochlear implant in my left ear,
Right.
and I will not. I will not bat an eye when that happens. Will I be sad when it happens? Yes, I will be sad because I will have to grieve that loss of how I hear today.
Right.
But I will not be as scared. I will, I'll move forward.
Well, I mean, is there anything you would say to people said, "Hey, Amanda, I want to hear better. I think a cochlear implant, but the only thing holding me up is the surgery." What would you say to them?
It's not. I understand why. I totally
Right.
understand why. And at the same time, on one hand, there's this risk and this fear, and then on the other hand, there's so much potential. And just kind of really talking to them about that and about that potential. And I've been there. I've been there, and I'm here now, and it's pretty cool.
Yeah, it's pretty awesome, right? And so, one of my favorite subjects in yours is so, I kind of saved for the end, but how does it impact your relationships with your children? Because I think that this is one.
Oh my gosh, who make me cry?
Right. Well, that's why I saved it for the
You make me cry.
end.
So it's interesting. So my kids know that I have a hearing impairment, right?
Yeah.
And so, I should have this. My husband at one point, right after I got my implant, he went on like Etsy or something, and he got this a Yoda doll, or I'm sorry, Grogu or whoever. Anywho, the Star Wars figure,
The
and
baby Yoda,
yeah,
whatever it's
Baby
called,
Yoda.
right?
And but I say that because whoever he bought it from, there was an image of a hearing aid on one ear and a cochlear implant on another.
Oh,
So
wow.
it was, yeah, so clever of him. And because my kids were 3 and 5 when I had the implant, so they didn't really understand, like what's going on. And so anyway, so it's been a really neat journey. But in terms of my relationships with them, like it's enriched it. Like I said, I can't imagine, like, I had the energy to hang out with them. I have the energy to play with them. I have I can hear them. I hear them. I hear them when they call me from upstairs. Hey, mom, like I, I need you, or like something's happened. I at least know, okay, I got to go respond. I wouldn't be able to do that without me. I would,
So you're saying with your pre-implant hearing aid, you wouldn't be able to do that.
with just the one hearing.
Yeah.
I don't think
Because
I
the
would.
other ear didn't take a
Yeah.
hearing aid, right?
Yeah, the combination of this combination allows me to do that. And so I can respond to their needs. And it just, that's what parents do, right? Like, you have this bond, and kids learn to trust you because they rely on you and you show up for them and all that stuff. So being able to hear and being able to be there when they need them. And the other thing is just, like I said, I hear them say I love you, and how important that is. And, you know, I'm really incredibly grateful. I
Yeah.
can't
So
explain
the thing that's so great about this particular interview for me, I mean, the other ones have been great, but what you're describing is why I get out of bed, right? In other
it.
words, the ability to have this change, right?
Yeah.
And so, and I think that I'm very blessed to be able to take care of wonderful people like you and get
Oh,
them better. But obviously, it's all on you to go through the journey.
absolutely. Absolutely. And the one thing I would also add is that I think, I mentioned earlier about, like, the relationship with hearing and health and well-being, like, and you mentioned earlier about control and taking the control back. And for me, that changed my life. Like, it seriously, I don't know how to, the relationships
It's an
that,
emancipation. You're
yeah,
not dependent on others to be your intermediary, right?
exactly. Yeah. But not only because you mentioned the reason I thought of it is because you mentioned my relationship with my kids, but also my relationship with myself is a lot
Right.
better.
Oh,
And
that's great. That's great.
yeah, so it's just, so I think that making this decision and the decisions that I've made, because this one, when you're a kid, when you're a kid, your parents make decisions, right? But as an adult, I had to make a very big decision for myself. And my kids have benefited. I've benefited, my husband, my friends. I mean, it's just been really, really wonderful. So I'm so grateful for you and that you're doing this. So
And how was your experience? I mean, I would love to say it's all me, but I have a team.
You
Right.
do.
Yeah. And how was your experience with the team? How was that?
They're wonderful. Absolutely wonderful. At one point, you mentioned the hearing test, the many, many hearing tests I had. At some point, it felt like Cheers, like going into your office.
Hey, Amanda's here.
Yeah. Like I knew like all the front desk stuff, like the front office people about my name. Like, I mean, you have a wonderful, wonderful, wonderful PA. I mean, and the audiology team, now I've gotten to know them. I mean, it's really, you're right. It is. And they've taken such good care of me. And I'm so, so, so thankful for each one of them. Truly.
Yeah. For the listeners, she does not have a parking spot with her name.
No, I do not. No.
And she doesn't. And there are no frequent flyer miles either, right? So we don't have either of those. So.
No.
Yeah. Well, this has been great. I very much appreciate you sharing your experience. I know it's very personal, but and positive and magical. And I really. So one of the questions I have for you is, what's your favorite sound? In other words, of all the sounds you hear, what's your favorite? Sounds like "Mommy, I love you," but
yeah, that's it. Yeah,
yeah,
I love you. Yeah, I love you.
And do you have any parting words for anybody, or that you would, any advice? It's okay if you do or don't, but sounds like just do it, right?
Just do it. Yeah, just do it. And at the same time, it's your journey. Like, you own it. And just like I've had to own mine. And and you just never know what you can unlock if you push play.
Yeah. Well, for everybody, this has been Amanda Mason. She's a wonderful patient in our practice that we've enjoyed to help take care of. And I really appreciate her sharing this with us. Amanda, thank you so much for your time and, sharing the personal side of your journey, which is wonderful. And I know there have been some hard days and some hard conversations, and, it's great to be here, and I'm so happy where you are.
Yeah.
So thanks for coming on.
Thank you. My pleasure.
Thanks for tuning in to the Listen Up podcast. We'll see you again next time, and be sure to click subscribe to get updates on future episodes.